Hello, my name is Cindy Mosier. I'm an RN nursing supervisor here for the ICU and PCCU at Northwest Bentonville, and I'm also a member of the Patient Safety Committee. I'm here today to ask for your support and endorsement for a new patient safety initiative known as Just Culture. The Patient Safety Committee believes that this is an essential tool to add to our system because we do not have a good record of reporting data or uncovering events that harm our patients. Without vigorous reporting, it is impossible to identify problematic areas that require further assessment and improvement. And Dr. Leap, while testifying before the Congress on the Healthcare Quality Improvement Act, stated that the single greatest impediment to error prevention in the medical industry is that we punish people for making mistakes. This was especially true prior to the 1990s. Perfect performance was expected and believed achievable. Employees were disciplined for errors. Often the level of discipline correlated to the level of harm. This drove errors underground, and near misses were never ever reported. And healthcare missed enormous opportunities to learn about risk and to implement changes to reduce the chance of errors. In the mid-1990s, a new culture emerged, and this was known as the blame-free culture. While it was a great improvement over the punitive culture, it also had its shortcomings. However, it did acknowledge that humans were imperfect people and recognized the impossibility of perfect performance. It recognized that most unsafe acts were the results of mental slips or lapses, honest mistakes that were rooted in system, process, technical, or environmental weaknesses. The focus was directed on fixing the system. Often you heard there are no bad people, just bad systems. The biggest problem with this idea though, was that it did not address the personal accountability that all of us have for the behavioral choices that we do make. It's time for a change, a new mentality, a fair and just culture, which is characterized by all members of the healthcare organization being aware that errors are inevitable. By reporting all errors and unintended events, they can facilitate organizational learning and make the system safer. In a fair and just culture, the greatest error is to not report a mistake and thereby prevent others from learning from your mistake. There are many benefits of a just culture. Employees of the healthcare organization benefit from a culture that supports accountability among all stakeholders. Managers have a practical tool to help them manage and respond to errors. Individuals have a framework to evaluate their own behavioral choices, and healthcare organizations can reduce risk and prioritize interventions associated with the risk more effectively. And a framework for proactive management of system designs and management of behavioral choices in place. We must develop a culture in which employees are willing to come forward in the interest of safety and in which productive investigative data is collected. It recognizes that some actions require personal accountability, disciplinary, or enforcement actions. It is this balancing of the need to learn from our mistakes and the need to take disciplinary actions that motivates adoption of a just culture. It also recognizes that competent professionals will make mistakes. We will develop unhealthy norms, shortcuts, routine role violations. But we also, in a just culture, have zero tolerance for reckless behavior. A just culture model focuses on appropriate response to error-causing behaviors in healthcare settings. Differentiated interventions or responses to errors are determined by what type of behavior produced the error. Several questions are asked at the beginning of the investigation and guides what the responses to the error-producing behavior will be. Was the individual knowingly impaired? Did the individual consciously decide to engage in an unsafe act? Did the caregiver make a mistake that individuals of similar skill and training would have made? And does the individual have a history of unsafe acts? If you'll open up your packet, you will see this algorithm in it. I'd like to take a few minutes to go through some of these behavioral choices and the appropriate interventions based upon the behavior discovered. Towards the left of your sheet, you will see the column that talks about impaired judgment. This caregiver's thinking is impaired by legal or illegal substances, cognitive impairment, or severe psychosocial disturbances. Discipline may be required, especially for illegal substances. Performance must be evaluated. Temporary work suspension may be helpful, and active assistance is offered to the employee. Obviously, examples include nurses, physicians, other caregivers, under the impairment of illegal drugs or alcohol. But also an aging physician who is displaying memory loss and poor critical thinking also fits into this category. The next section is malicious actions, and thank goodness these are very rare in healthcare. but the caregiver actually wanted to cause harm. Disciplinary and/or legal proceedings are warranted, and caregiver's duties should be suspended immediately. An example of this would be a terrible one, where a nurse attempts to kill a patient by purposely giving a lethal dose of sedation. Reckless behavior. In this case, the caregiver knowingly violates a rule or makes a dangerous or unsafe choice. The decision seems to have been made with little or no concern to the risk. Discipline may be warranted. These situations demonstrate a knowing disregard for patient safety and demand remedial and punitive actions. Managerial responses must send a no-tolerance message. If the caregiver is accountable for his decision-making and needs retraining and should also participate in teaching others the lessons he or she has learned. At-risk behavior. In this, the caregiver made a potentially unsafe choice, but faulty or self-serving decision may be evident. In this case, the decision was not to cause harm, and they thought that they were acting in a safe manner. Coaching is warranted, and the caregiver is accountable and needs retraining and should participate in teaching others lessons. At-risk behaviors are very common in healthcare. As a matter of fact, most nurses and others would tell you that at-risk behaviors is the greatest problem that we face. To err is human, but to drift is human too. Think about driving down the road. All of us know the speed limit is 60, but yet how many of us go 60? We drift into 65 and 70 because it's okay. We tend to stretch our limits just a little bit because we lose perception of the risk attached to everyday behaviors. We're more concerned with the immediate and certain consequences of our behaviors, getting there faster, spending less time in the car. And workers try to do more with less, take shortcuts and drift away from behaviors they know are safe. The rewards of at-risk behaviors are common, and oftentimes doing safe behavioral choices may evoke criticism from their peers. An example is a nurse who takes a longer time to administer medications, even though the additional time is justifiable because it's attributed to safe medication practices and also patient education. But a nurse who's able to handle half a dozen admissions on a shift, she may be praised, admired, and even emulated, even if dangerous shortcuts have been taken. Therein lies the problem. The solution here is not to punish the people who engage in these behaviors, but uncover the system-based reasons for their behaviors and to modify the system, and to make risk-taking less appealing. Incentives for unsafe behaviors need to be uncovered and removed. We need to develop stronger incentives for at-risk behaviors and coach workers on how to make better behavioral choices. Human error, unintentional error. The caregiver makes an error while working appropriately and in the patient's best interest. The caregiver is not accountable, and we should console this employee. They made a mistake and they feel terrible about it. The employee should participate in the investigation and help teach others about what was found out. If the employee has a history of the behavior, we need to take a different look at this, and we may need to escalate the disciplinary process. And then we also need to look and see if 3 caregivers with similar training or skills would do the same thing. If so, the system supports behavior and it requires fixing. System leaders share in this accountability. In conclusion, I would like to say that a just culture supports the learning environment that balances safe reporting with personal accountability. It improves patient safety by allowing organizations to leverage error reporting data to prioritize systems and/or process redesign and to manage worker behavior choices. I would like you to support and endorse the adoption of a just culture here at Northwest Medical Center. Do you have any questions that I could answer at this time?